The sooner you can identify a hypo when it occurs, the sooner you can treat it and raise your blood glucose levels back to normal. Many people are not fully aware when they are having a hypo, and having hypo unawareness can make the symptoms harder to recognise. Understanding the wide range of symptoms can help you spot signs you may not have been looking out for or realised were warning signs. You may experience multiple physical symptoms indicating a hypo, and it's important to check your blood glucose if you think you might be low. The most noticeable physical symptoms include headache, elevated pulse rate or pounding heart, nausea, abnormal hunger, fatigue or drowsiness, poor coordination or clumsiness, weakness or trembling, dizziness or lightheadedness, excessive sweating, chills or clammy skin, a feeling of falling, hand twitches, and visual impairments such as blurred or double vision, hallucinations and seeing spots. You may also experience emotional symptoms, which could indicate your blood glucose is falling, even if you feel fine physically. Keep an eye out for the following emotional symptoms: lack of concentration, restlessness or irritability, silliness, aggression, stubbornness, confusion, anxiety, nervousness or panic, acting out of character, and any other unusually heightened emotions. Nighttime hypos can be trickier to manage, particularly as you might wake up feeling groggy and need a few moments to evaluate how you feel. They can be a particular concern for you as they are unpredictable and hard to detect. You should test your blood glucose if you experience any of these symptoms at night: insomnia or poor sleep, and/or feelings of anxiety, sudden awakening from sleep or tiredness, excessive perspiration or night sweats, especially clammy skin on the back of your neck, jerking movements which can precede convulsions, great hunger, and vivid dreams or nightmares. Some physical symptoms of hypos can be difficult to spot, often because they are only visible to other people. It's beneficial to explain the following hyposymptoms to your family and friends. They can then identify when they think you may be low. You should test your blood glucose immediately if you or someone else notice any of these symptoms: dilated pupils, pale complexion, nystagmus, this is a continuous uncontrolled back and forth movement of the eyes, slurred speech, glassy or staring eyes, appearing confused, tiredness during tasks involving small amounts of effort, such as climbing a single flight of stairs, sweating, talking or shouting out during sleep, or lack of coordination, such as dropping things. Sometimes when you're absorbed in a task or an activity, you might not be focused on how you're feeling. It's therefore possible to miss performance symptoms, which could indicate you're having a hypo. These include a task taking longer than it should do, a task requiring more concentration than normal, and making frequent mistakes. Severe hypo symptoms can be markedly more pronounced than other hypo symptoms. As we mentioned in the previous module, a severe hypo should be recognised as a medical emergency. These symptoms include confusion or disorientation, slurred speech, panicking, sweating for no apparent reason, falling over for no apparent reason or having difficulty walking or standing, seizure, and unconsciousness. Keeping a hypo treatment kit on you at all times is essential in case you feel severe hypo symptoms. Make sure you mark down which hypo symptoms you feel in the hypo record sheet and whether they correspond with low blood glucose. Did you know why the body presents a wide range of hypo symptoms during low blood glucose? It's because a decrease in blood glucose triggers the release of adrenaline from the adrenal glands. When adrenaline is released, the production of glucose is stimulated from body stores. This causes symptoms similar to those of an anxiety attack, such as hunger, sweating, nervousness, or shaking.